Hello, everyone. Today we are honored to have Dr. Carmody with us. Dr. Carmody has been a very prominent name in med-ed circles for some time now. He is a pediatric nephrologist. Primarily, he works with Eastern Virginia Medical University students in Norfolk, Virginia, and he works there as a consultant in their children's hospital as well. Uh, Today, we will be talking briefly about this score invalidation, USMLE score invalidation, because honestly, the most information I have gotten about it and very the like valid information is from Dr. Carmody's videos and his post on X, formerly known as Twitter. So, without further ado, I would welcome Dr. Carmody. Thanks, Dr. Carmody, for joining us.
Oh, it's a pleasure to be here. Thank you for having me.
And without wasting your precious time, what I would do is, so my understanding is, first of all, my question would be that how did you get to know about all of this score invalidation? Uh, can you tell me a little bit about that?
Yeah, sure. I mean, I didn't hear about the invalidations any sooner than anyone else. I mean, that announcement came out on January 31st,
Mhm.
2024. But I had been hearing about USMLE recalls, I mean, really for several years, and about recalls that were sort of I guess at the center of these invalidations. I started hearing about that back in the fall of 2023.
Okay. All right. Now, as an IMG myself from Pakistan, my understanding is that so I took my exams back in 2016, 2015, 16. And even at that time, there were always rumors that there were some med schools all over the world, not so from I would don't want to name countries, but all over the world, they were like using some recalls. And by recalls, I mean that let's say that a group of 10 students took exams and then they would recall some of the questions, which, according to my understanding, even sometimes the US graduates would use that as well. Now, in your opinion, first question, do you think those recalls, just per se recalls, are they illegal? That's my question.
That's a good question. I mean, the simple answer is, I mean, according to the USMLE, the agreement that you make with the USMLE when you take the test, all those are illegal. I mean, insofar as you're not supposed to share exam materials once you leave the center. I think
Absolutely.
in reality, though, I mean, there's a spectrum of things that are sort of common and probably generally accepted all the way to the other end of the spectrum, which is the things that led to these score invalidations. I mean, what you mentioned, I mean, um, talking about things that you've seen on the test in sort of a general way. I mean, if you said, "Oh, I had a lot of questions about heart failure. You should probably learn about heart failure." I don't know. Is that cheating? Probably not. I mean, telling you that you need to learn a topic that's on there. That's a little bit distinct from saying, there was specifically a question where, the guy had a chest x-ray that looked like this and the labs look like this and the question asks such and such and the right answer is this. And you share that in a forum where it's, deliberately shared with other people. That's sort of that undermines the purpose of the test.
Understandable. And I must say that I took also the specialization exam in my country, Pakistan. That is itself considered a very difficult exam. And then I have had interaction with people who have taken PLAB of UK at Royal College of Physician exams. And I must say that overall, my observation and understanding is that USMLE exams are perhaps the toughest across the board. And I think the reason they are toughest is because it actually they are the same exams that the US medical graduates take, which is, I think, different from all over the world, where
Yeah.
most of the time the foreign graduates have to undertake those exams, not their native students. So, what you are saying is now, why did it so my understanding it did not happen all of a sudden. There were some investigations going on. So what
Yeah.
actually, because USMLE, I'm pretty sure they were aware that people were sharing recalls, and I guess in a way they were fine about it. But what happened that all hell broke loose.
Yeah, right. So, the bottom line for this scandal is that, I mean, the disappointing thing is that things reached such a scale that uh, we're talking about this today. And all of that seems to have occurred without the USMLE noticing it as part of their routine operations. I mean, all of the scores that have been invalidated, all the investigations that have taken place so far, at least so far as we know, those have all been in direct response to complaints from people complaining to the USMLE about cheating occurring. So and then, of course, for this, for this recent announcement, once the USMLE began to investigate it, I mean, the evidence was overwhelming. I mean, you could see the evidence of the cheating on a national level when you looked at specific test centers, in specific parts of the world, and the fact that that sort of escaped detection until someone pointed it out is really sort of disappointing.
So basically, uh, allegedly, the one center in Nepal, I think that was. So my question to you, whether that center was the first question, was it a prometric, and whether they were sending the exact screenshots of the questions, that these are two of
Yeah.
my questions.
Well, that's what I've heard is that so again, I think I heard about these specific things probably in about September of 2023, maybe August, September. And I heard from, I mean, one fun thing about talking about some of the stuff that I do is that I get to hear from all different kinds of people about all kinds of different things. And so I got a couple of messages saying that examinees in Nepal were using verbatim USMLE test questions. And so I encouraged the person telling me this because, periodically I've heard about recalls and I've not chosen to discuss it because I didn't really want to advertise the use of these things, for people who were blissfully unaware. And although on one occasion several years ago, I actually did email someone at the NBME about one thing that I'd heard, but actually not about this. I did tell the people who messaged me that they should report it to the NBME because they, were in possession of this information. So in the court documents, because of course after these invalidations came out, there was a legal case where one of the examinees whose scores were invalidated asked for an injunction against the USMLE to prevent them from invalidating her score and for it to continue to be reported so that she could match. And that motion was denied by the court. But in the filings that came out, the USMLE had to sort of tell at least some of the information that they'd used to identify the scores that they invalidated. And I read those documents carefully, and they do acknowledge that there were concerns about the test center, but they're not specific about what those concerns were. And the methods that they used to describe identifying examinees whose scores were not believed to be valid do not require them to have sort of the smoking gun of actual test questions identified.
All right, I understand what you're saying. Now, the other thing which a lot of people have been discussing is that Telegram group. And I'll be very honest with you, prior to that, I had maybe no knowledge about what even Telegram is. I maybe I have heard that it's one of the social media forums. So it seems like that there's a group where people like sell questions. Can you tell me a little bit about that?
Yeah, so there's a number of those. I mean, that's the kind of thing that I've heard about really going back to like 2019 when I started talking about these things. I mean, I started
Mhm.
hearing about those things in different places early on. And like I said, in one case several years ago, I did actually communicate some of that to the NBME. So, um, interestingly, um, I told you I became aware of this in the fall, and there was a reporter from Medscape who got interested in this story and was working on this story actually for quite a while before the NBME made the announcement. And
Mhm.
I think she had been tipped off. I guess there were some posts on Reddit and some things elsewhere that where people were complaining about high scores and the possibility of cheating. And so this reporter started looking into it, and she spoke to me as part of her story in probably like early January. I spoke to her a couple times.
Mhm.
And as part of her reporting, she actually acquired some of these USMLE recalls and she shared them with me. And the document that she shared with me was strikingly low quality. Now, I guess this was offered to her as sort of the free preview before you had to pay hundreds of dollars to get the other recalls. But
Okay.
the things that she showed me, I would actually say had negative study value versus actually spending time trying to learn something about medicine. The questions were poorly and incompletely recalled, and really, I don't think were very valuable. At least what was shared with her there. But that was the free product, I guess.
Okay. So basically, what you're saying is that there are multiple, maybe Telegram and other groups
Oh
that were
yeah,
selling the questions.
right.
So okay, now the question which a lot of people are asking is, sh- so they must have run some sting operation. They found out. Now my question is that during the match season, where people have interviewed, some gotten pre-match, the rank order list is upon us. I want your personal opinion upon the timing of all of that. Do you think, like, a first question, is the time right? And the second question is, the way they started by specifically mentioning Nepal, was that the right thing to do in your opinion?
Yeah, those are good questions too. So, and it's interesting now that over the past couple of days, there's been more score invalidations that seem not to involve Nepal. And there's not been, at least as the time that we're recording this, there's not been another announcement from USMLE regarding these additional invalidations. My personal opinion is that the USMLE rushed to make this announcement a little bit. And I mentioned there was a reporter from Medscape who was working on this story. And as she was winding up her reporting, in the days before the announcement, she reached out to the NBME to comment. And the nature of the story at that point was that, the use of these recalls is widespread and frequent, and people are complaining about it. So she went to them with this story, and which was about to be published in a couple of days. And of course, in parallel, they had been working on this investigation. And my personal feeling is that they were nudged to announce it probably a little bit sooner to get out ahead of the news story that was coming. So I think that that's my opinion based on what I know from the reporting that was going on. I think that she forced their hand a little bit. Um,
Okay.
and and I think that's also sort of made clear by when the USMLE announced this. Of course, that has consequences, as you said, for a number of other players. It has consequences for the programs and for the NRMP and for the ACGME. And those organizations seemed to be caught off guard. I mean, it took them a day or two to make statements, and
Hmm.
initially, of course, programs, their main question was, well, did I interview people whose scores are going to be validated? Do I need to interview more people? Am I going to be able to rank these people? And you couldn't find out that information
Hmm.
initially. If you wanted to know it, you had to email the NBME and you got a response in a couple of days. I mean, you could send them a list of, hey, here's the people whose AAMC ID numbers I interviewed. Are any of them going to have invalidated scores? And they'd get back to you. But I don't think that's how you would set it up if this was sort of the timing that they had wanted to, the time frame they'd wanted to work on. So my opinion is that they um, they named Nepal as a way of sort of preventing a widespread panic among programs. I mean, if the USMLE had instead said, which in hindsight might have been a more fair thing to say now that we're seeing additional score invalidations. If instead they had said, we're invalidating the USMLE scores of 832 examinees, and there may be more to come, programs would be like, well, who are they? Did I interview them? And so
Yeah.
I feel that citing the country was they were trying to sort of throw some breadcrumbs that programs could follow the trail and sort of have an idea about where things were going. And I think in retrospect, they may regret that.
Yeah, no, because there's right now, as things stand, especially with the new wave of invalidation. So there's so much confusion that can the program directors rank those people? Because technically, let's say if someone CK score is invalidated, it means that they are no longer ECFMG certified, that which is one of the requirement. With no ECFMG certification, technically they might not be able to get, let's say one of the things is J1 visa for residency, among a lot of other stuff. So I think that, again, I'm not a legal expert, but that in itself also like opens e NBME to a lot of lawsuits in terms of even
Correct.
timings. So, and there's a very, very widely the concerns have been shared by a lot of leadership of the programs that I absolutely agree with you. They were caught off guard. Now, the other question to it is with the recent wave of invalidation, which countries have been affected? Again, just your personal observation and opinion, because I don't see that there has not been any official word from NBME or ECFMG.
Right. Yeah. So, of course, the NBME cited Nepal, and in the lawsuit, they acknowledged having received complaints about cheating occurring in Jordan, India, and Pakistan. Those countries were named in the response to the lawsuit that we mentioned before. Um, what I've heard about over the past couple of days seems to be examinations from Pakistan. At least that's the discussion on social media. But again, the NBME has been silent so far about how many or where these examinees are. And I think um, on the one hand, that's understandable given the blowback that they received from citing the country the first time around. But on the other hand, um, if your goal is to deter cheating or to show that you take it seriously, operating in secret really works at cross purposes for that.
Yes, absolutely. And I think one of the concerning things, which again, so this it's all hearsay, that they have invalidated score of some of the people that are actively doing residency.
Right.
So I think that is even more concerning for so many reasons. That program, again, CK is nullified. You are no longer ECFMG certified. Even if you had taken step three, I don't know whether FSMB would even acknowledge it, because if you are not ECFMG certified, you can no longer be eligible for step three. Now, their state licenses, whether they would be applicable or not, their work visa. So there are so many questions that need to be answered. Now, the other aspect of it is that, again, I'm from Pakistan, and Pakistan, I think, contributes maybe India is number one, uh, the most number of IMGs, maybe Pakistan and Canada. So these are the top three countries. So the concern would be, and again, I absolutely condemn cheating. And I think that anyone who they have proved that have been involved in cheating should be punished. But my other concern is that in doing so, we must be very mindful about that no innocent should be caught up in all that. So that's another thing that also we have to be mindful, because there is one thing that the applicants they have not matched. Now, people who are doing residencies, it opens a whole set of Pandora's boxes. What's your opinion on that?
Yeah, it certainly does. I mean, although I'll be honest, if you uh, so you're certainly right. It creates problems for the program. It creates many problems for the person involved. Um, and I guess I should say, I mean, the problems that it creates for the resident are sort of those were self-imposed, because
Mhm.
if you hadn't cheated, you wouldn't have found yourself caught up in that. But
Yep.
that's the I think that's why the USMLE is working to make this additional wave of invalidations now, because of course, rank order lists get certified tomorrow, by programs and applicants, and so after that, there's potential risk that, I mean, if you invalidate someone's scores in April, programs will have matched residents that are not going to be able to join. Now, I think if you're a resident that's caught up in this, I mean, the ACGME has issued guidance, about how programs are supposed to handle this. And, if you have a score, if you have your step one or step two score invalidated, as you mentioned, you no longer can be ECFMG certified. So you're no longer eligible to train in an ACGME accredited program. So those residents have to be suspended. But the ACGME has emphasized that the residents have to receive due process before they can be terminated. So what that is will depend on the nature of their contract with the institution. But if you were a resident who is already matched, in a way, you're better off than I mean, actually, in many ways, you're better off than the people who never matched in the first place because you're going to get suspended, but you're going to get a free retake on the USMLE exam, and all you got to do is pass. If you pass, then your ECFMG certification is going to be reinstated and likely, I mean, maybe not in every place, but I think likely the program is going to work with you.
Okay, so what you're saying is, and that was my actually next question, that now the scores have been invalidated. Now what's next? So would they allow a retake of exam? First thing is you're saying it's free of cost for the people who are already in the program or free of cost for everyone?
Yeah. So if your scores are invalidated, so basically the NBME gave those who had their scores invalidated, they gave them three options.
Okay.
Option one was that they could appeal to the NBME.
Mhm.
Option two was that they could accept the invalidation and take a retake of whatever scores had been invalidated at the NBME's expense. So you get a free retake that will be scheduled in the future and you take it. And then option three was to do nothing, in which you reserved your right to sue the NBME, because if you chose option one or two, part of that deal was that you were agreeing not to sue them. So if you do
Okay.
nothing, you could take your case to the courts and fight it. But if I would say, if you were a resident, if a resident asked me, if they emailed me and said, Dr. Carmody, I'm really ashamed about this, but I
Mhm.
looked at these recalls, my score got invalidated, I'm now suspended from my program. What would I do? I would say, what you need to do is, do good relationship management with your program director and with your program, and you need to grind as hard as you can and pass that USMLE retake now. And I would urge them not to try to appeal to the NBME or to fight in the courts. And I'll tell you why. Number one, I think they're going to lose. I think the evidence that cheating occurred is overwhelming. But number two, if you force the NBME to show the evidence that you have against you, it may hurt you in another way, which is with your licensure. Because most state licensure, you have to pass USMLE, sure, but there's
Mhm.
also a morals clause that you have to be of good moral character. And
Uh,
so if you get a score invalidated and you come back and you take it again, and you pass, you may get back on track. But if you decide to fight it and you make the NBME show all the evidence that they have that you cheated, now you're calling into question your moral character in a way that might not have come to the board's attention as much otherwise. So yeah, like I said, I mean, many of the people who are residents, they're going to be on the way out regardless. But many of them, as I said, when I talked about this in a video, I think many of them actually will land on their feet if they play their cards right.
okay. So basically, now the revalidation exam would be a similar, let's say, CK exam, but they just now the passing criteria, would it still be that 209 figure? That's another question.
Yeah, right. But you got to imagine that the questions are going to be the freshest, cleanest, uncontaminated questions, hot off the presses, from the USMLE. So I think you better know your stuff when you go in there. But again, if
Yeah.
you're already in a program, the score doesn't really matter.
Yes.
You're already
Mhm.
matched. You just need to pass.
Sure.
Even if you got a 275 the first time and a 215 the second time, um, that could occur legitimately because, of course, when you took the step two exam the first go around, it was under ideal circumstances. You were
Yeah.
studying for a long time. You had no other responsibilities. Now you're taking it under time pressure. You're losing your visa. You're facing deportation. You've got all these things working against you. It would be very understandable. You would have a case you could make to say, well, of course my score is lower because look at the situation I'm in.
Okay. Now, the other question is, so these are for resident. Now, people who, let's say, haven't even applied for residency, or let's say they applied for residency and they are not being ranked. Now, if they retake the exam, in their transcript, would it be mentioned that they had to retake it for invalidation? That's another question.
Yeah, so what their transcript will look like is it will list the date that they took the USMLE, and it'll say score not available for any score that's been invalidated. So if they come back on their retake and they pass the exam or they don't, that will be listed on their transcript. So what has yet to be seen is how impactful that would be on residency selection, because I don't know. I mean, at least right now, Eris does not have a filter to help you find that information.
Mhm.
Now, I could imagine that next year they could add a filter to allow you to identify examinees who have one or more of their USMLE attempts as score not available. But right now, if that were happening now, the program would have to, if there's a way of doing this other than what I'm about to describe, I don't know it. But in Eris, you would have to go in and look at the PDF document of their USMLE transcript, because the only thing that auto populates is the most recent USMLE attempt.
And that also creates other set of questions that, let's say, even if they take it, and let's say even two scenario. One thing is that their invalidated score was 265. They retake it, they do take around 250, 255. So in a way, that's good that you actually proved yourself. But again, in a way back, if I'm program director, potentially in my mind is that his or her score was invalidated. So it's possible that that
Right.
person might have been involved in
Right.
cheating. So whether I should give that person a chance or not, that's another thing that we will see in the
Correct.
following year.
Yeah, correct. And I think many program directors, when you see that score not available, that's going to be the kiss of death, because they're going to know what that means. But
Yeah.
I think that some won't. I mean, I think that's the truth, is that
Hmm.
some will not. By the time that we're this 2025 and it's a new match, and everything's new in the world again. I'm telling you, not all program directors are going to look for that, or know to look for it, or know the significance of it if they saw it.
Now, my last question to you, and again, it's just an observational question. With the recent wave of invalidation, it appears that most or all of them were Pakistani applicants. Some people have been raising the question and asking is that, again, the cheating that was going on specifically after they mentioned India, Jordan, and Nepal, it's almost seems, again, anything is possible, seems unreal that the people from India and Jordan did not do that. Again, it's anything is possible, but it seems unreal they did not do it. Now, a couple of days prior to the rank order list, they invalidated scores just from Pakistan, allegedly, and not from India and Jordan. Do you think that any specific reason for any specific reason for that, and B, is it like unfair to specifically Pakistani applicants? Because 2 days before the rank order list, if I'm PD, I am having doubts that down the line maybe more Pakistanis would
Yeah.
be part of that invalidation, and I don't rank them at all. What do you think about that?
Yeah, right. Yeah, so I think that this is my again, I don't have any inside information here, but
Hmm.
my feeling is that the USMLE is working through all the tips that they have. I mean, as I mentioned, the investigations that they've done, they didn't just do because they were sitting around at their headquarters in Philadelphia and they just got the idea in their head to investigate. Someone pointed out, that there was cheating, and here it is. Here's the link to the Telegram group, or here's this. So, and those first tips came in January of 2023. So it tells you that, I mean, again, the announcement was made at the end of January 2024. So their process isn't exactly swift, you know. So um, I think that they're working through the other tips that they have. And as we discussed earlier, the lawsuit acknowledged that they have evidence. They have tips and some suggestive evidence that this is occurring in at least three other countries. And I don't think it's confined to those three either. I think that it's more widespread than that. So I think that we will see more invalidations. As to your second question, I think it does hurt IMG applicants from these countries. I mean, I think the Nepali applicants whose scores still stand, I think they've probably been hurt the worst because, I think many program directors will look at them and wonder, if I match this person, are they going to get here and, not be as good as their scores would indicate? Or are they going to get here and even worse, we're going to find out that then, their score gets invalidated in 6 months or 12 months from now? I think that will hurt them. And I think you're right. That contagion is sort of spreading now to other countries where been this, these concerns about cheating. So I do think, though, I mean, I think if you're an honest test taker from those countries, you want this to happen. You want the cheaters to be identified so that people move on. And then when the dust settles, like I say, I mean, a year is a long time in match terms,
Yes.
and a year from now, this will not be fresh on people's minds, and especially if there's not this sort of ongoing threat of more investigations that are going to find more people and invalidate people that might be working in your residency program. I think then program directors will have much more confidence, evaluating applicants from anywhere in the world.
Right. Well, thanks a lot. What will be your last concluding message for the people who are in process of preparing for the exam, taking the exams, both especially for IMGs, in light of what has been happening? What will be your message?
Yeah, I would say, this will sound a little bit, I don't know, I mean this sincerely. Um, if you're cheating for the exam, honestly, you're cheating yourself. That's the honest truth. There's going to come a time as a physician where your decisions matter. They matter to real people, and you want to be as good as you possibly can be. And certainly, it's easier to get a high score if you know the questions that are coming. But one day, when you go into your office, you're not going to open the door and see a multiple choice question that was on the USMLE 5 years ago. You're going to see a real human who's got a real problem, who needs you to make a good decision. And so taking the longer road and working hard and learning this stuff, that will serve you better in the end. That's the honest truth. And it'll serve your patients better in the end.
Absolutely. And I would just give my example that during my med school, I was an average student and I took the exams and in step one, I scored a little bit lower. On CK, it was above average. And there are a lot of people like me who, after this finding, they felt in a way, they felt what I should say, in a way, sad that we really worked hard. And even despite of working hard, because we took it honestly and our scores were okay-ish, but then there are some people that just took the shorter route and their scores were like really high. So you're right in a way. And to all my audience, what I want to say is that in no way I would encourage cheating. I always condemn it. But my question and my concern is that no innocent person should also be punished for a cheating that some other people did. So again, investigation should be very fair, irrespective of the race, gender, ethnicity, country, and the culture of cheating must end.
Agreed.
Thank you. Thanks a lot, Dr. Karmoudi. Have a good rest of your day.
Hey, you too.